Okay, welcome everybody and Happy New Year. Apologize for the technical difficulties. But today, let's work through our current numbers in a few minutes. But first, I wanted to again thank our ICU nurse that we had last Wednesday, the last briefing of 2020, ICU nurse Natalie Crawford. Now, Natalie is just one of many healthcare professionals who are on the front lines each and every day. She works in the intensive care unit at SSM Health's St. Joseph Hospital in Lake St. Louis. And last Wednesday, she gave an incredibly powerful talk about two patients that she had cared for. Both patients ultimately lost their fight with COVID. And if you haven't seen that program from last Wednesday, I would encourage you to go back and take a look. And I would also encourage you to share it with others. So if you know somebody that thinks the virus won't hurt them, please have them listen to a nurse like Natalie, who has watched otherwise healthy people get very sick and die. Or if you know of somebody who believes that they will easily recover from this virus, please have them go and listen to Natalie, who will tell you firsthand what this virus does to individuals and families. So although you might do well with the virus, if you're not practicing all of those things that we talked about, such as wearing a mask, social distancing, and not gathering in crowds, you might very well pass it on to somebody who doesn't do well. So my hope is that in hearing Natalie and other healthcare professionals talk about what their patients are going through, that it may change some people's perspectives, and I hope it will also save some lives. So keep in mind that COVID has already killed about 1 in every 1,000 Americans. So just think of that. In less than a year, this virus has killed more than 350,000 Americans and has become one of the leading causes of death in our country. Every day, families, patients are having to make incredibly difficult decisions because the virus got to them before the vaccine could. And the economic and emotional impact has been devastating as well. This new year is an opportunity to turn the page. Now, I firmly believe that 2021 will eventually be better than 2020 in many, many ways. We know vaccinations will happen, and we know that COVID therapies will continue to improve. And I think more people will see that masks and social distancing are the most immediate and effective ways that we have to prevent spread of the virus until we get to mass vaccination. But as we said last week, improvements in 2021 are not going to happen right away, and it's not going to be easy. The past couple of months have been very difficult, and the next 2 months will likely be as well. While we can wait to get through this phase, please take the steps that you know will help prevent transmission of the virus, and that is wearing a mask, social distancing, washing your hands, avoiding large crowds, until we can get to vaccine for the majority of the population. Now let's take a look at the numbers and see where we stand today. So as always, we start off with our hospital admissions. Again, these are COVID positive patients, 2-day lag. Today we're reporting 107 admissions to task force hospitals, and our 7-day rolling average is at 95. So it's below that 100 mark that we've been sitting at for quite some time, but still way too high. Next, we'll look at our hospitalizations. Today, we're reporting 836 patients hospitalized with confirmed COVID-19. The moving average now is at 802 patients. And a little bit more detail on some of our numbers. Again, we're reporting 836 confirmed COVID-positive patients in our hospitals. We have 180 patients in our intensive care units. That compares with 175 yesterday. And we have 109 confirmed COVID-positive patients on ventilators today, compared with 111 yesterday. Now we'll take a look at our suspected COVID patients. So again, these are patients where we're waiting for a test result to come back. Today we're reporting 48 hospitalizations of suspected COVID. We have 8 suspected COVID patients in our intensive care units, and we have 3 suspected COVID patients on ventilators. Our good news slide, again, discharged 62 patients yesterday from our task force hospitals, which brings our grand total up to 14,967 patients discharged from our task force hospitals yesterday. So again, a credit to all of our hardworking nurses, techs, everybody that supports them to get these patients well enough to go home. So it's Monday, and typically we go over our modeling slides. First, we wanted to show you the number of deaths that occurred yesterday as well. So we're reporting 17 COVID-positive deaths yesterday, and our moving average is 17. So again, still a significantly high number of deaths that are occurring. And anytime that we have high numbers of hospitalizations, high numbers of people in our intensive care units, we're going to see that number of deaths. So as I said, today we'll go over our models like we do on every Monday. And so again, we haven't changed the model since December 17th because the census has been tracking along with our best guess. So now it's a little bit in between our best guess and our lower bound. So we're hopeful that this will continue, but there's a couple of things that give us a little bit of pause, which I'll talk about here in a minute. These are the alternative models, and so this is when I say it gives us a little bit of pause to start thinking about, okay, so where are we going from here? So again, we seem to be tracking along that gold line, which is our most optimistic outlook. So that is keeping with a reproductive factor below 1, which we were seeing in last week. Now, since that time, though, we have moved a little bit up from there. And we don't know what the holiday season is going to bring us in terms of cases, hospitalizations, things like that. And then there's the third thing, which is the UK variant of the coronavirus, which is reported to be more transmissible. And so when you package all these things together, it gives us a little bit of concern. So this is where we are with the model right now, but we also have some significant other issues that make us a little bit worried about where we're going to be going in the future. Again, this is a enhanced version of our hospital census, and as I said before, we're trending below that best guess line, and in between there and our lower bound, still though at significantly high levels. So as we reported, we're still in that 800 plus range for patients, and we're still at 180 patients in our ICUs. And so by no means are we out of the woods yet when it comes to patients in our hospitals. And then our ICU census is following along that same line as well, a little bit below our best guess, but still a significantly high number of patients in our intensive care units. Looking at our epi curves, so this is the epi curve for the statistical area. Again, it's come down. Now, some of that is most likely artifactual because there wasn't much testing going on over Christmas or over the New Year's holiday. And so typically what results is we play a little bit of catch-up. So people that weren't tested on the holiday will then get tested the next day, and that pushes those numbers up even further. Labs aren't reporting significant numbers on those days as well because of decreased operations. And so we usually give it a couple of days up to a week for the reporting numbers to catch up. And so we'll see what happens there. Now, I would love for us to be wrong and for those numbers to continue down, but we have to see if there was that lull because of the reporting period. The epi curves for the counties around the statistical area look pretty much the same. It's really just the rate that they've fallen where there's any difference. You can see a couple of areas over on the east side, over in Illinois, where they haven't dropped quite as much as they have in other places. But the curves look similar, which also means that the testing issue is probably the same across all of the counties as well, if there's a delay in performing tests or reporting tests. In looking at our epi curves from around the state, same sorts of curves that we're seeing with the decrease in the number of cases. Some are remaining a little bit higher than others. So specifically down in the Springfield area, they've still maintained that pretty high level. But you've seen that drop as well from where the holidays occurred. And so we'll have to take a look and see what happens after some of those numbers get caught up. And then our reproductive number, as I mentioned earlier, it was hovering below 1 for quite some time last week, but now it has popped back up to above 1. So these slides were made last Thursday when we do our modeling, but looking at our report card today, we're at 1 right now, where previously we were at around a 0.8. So we know we've come up since last Thursday. And then looking at our changes in cases by county week over week, you'll notice that most of this map is blue, and that's because of that decrease in the number of cases. So that changes that 14-day rolling average, and so that's going to turn the map blue. So again, we have to wait and see what happens in the next couple of weeks to see if that number of cases increases. If it does, then this map will gradually turn back to that brown color. Again, I want it to be blue all of the time, but we have to see what the holidays bring. And then our zip code data, only a couple of areas to report here. Looks like Moline Acres on the east side, and then St. Louis City. The rest of the map, though, has seen a decrease in the number of reported cases. So over the last week or so, we're seeing some softening of the data, but we really need to see what is occurring post-holiday. So the numbers that we're seeing because of decreased number of testing that is performed, decreased reporting out, any of a number of things, how many people adhered to the advice of not getting together for the holidays in large groups, practicing social distancing, things like that. But at any rate, the numbers are still way too high. Anytime that we have over 800 patients in our hospitals with COVID, the number is just much too high. And anytime we're still reporting over 100 admissions a day, still those numbers are much too high. So we'll keep an eye on the numbers, see what happens over the next couple of weeks. We are keeping our eye on that new strain that has been circulating in the United States. Has only been discovered in a couple of places, but that's mostly because there hasn't been a lot of genomic discovery of the virus. And so it will make it here sooner or later. There's no doubt about that. The question is when, and then what happens when it does arrive. And so with that, I'm going to go ahead and take a few questions from the media.
Does the vaccine expire or go bad once it is open? Does every bit need to be used right away?
So yes, you have a certain amount of time from when you draw the vaccine up. So the Pfizer, I'm talking specifically about the Pfizer vaccine. So once you take it out of the ultra cold storage, let it get thawed, reconstitute it, and then draw it up, you do have a certain amount of time that you have to use the vaccine. That's one of the challenging aspects of this vaccine is once you draw it up, then you have to use it, or else it goes bad. So yes, there is a time limitation on when you need to use the vaccine. So for instance, if we have vaccine that we've drawn up during our vaccination clinics in the hospitals, and we've already gone through the list of people that were there to get vaccinated, and we have leftover vaccine, then sometimes our teams will go around the hospital and offer vaccine to people who didn't have a chance to sign up. And so we make sure that we use all of the vaccine. None of it goes to waste.
Have any doses in the region expired or had to be disposed of that the task force knows about?
Not that I know of. And so just what I said earlier, if we have vaccine left over that we don't have people signed up for vaccinations for, then the teams will go through the hospital and vaccinate other people, even if it was before their time to get vaccinated. And that way, no vaccine goes to waste. I mean, the true goal of vaccine is to develop herd immunity, and we try and prioritize those populations as much as possible, but we don't want to waste vaccine either.
Does the standard PCR coronavirus test show if someone has the new coronavirus strain?
It should. So the coronavirus PCR test doesn't look for the whole genome. It looks for individual snippets of RNA. Which are specific to COVID-19, to SARS-CoV-2. Now, the small mutations within the genetic code, such as that UK mutation, should not play a factor in those snippets of RNA that the PCR looks for. So it should be able to find that UK version as well.
And if the standard test shows, are health systems looking for the new strain?
So there's a difference between the PCR test and then a genetic decoding. So in order to understand which variant of SARS-CoV-2, you'd have to decode the RNA. So other countries, UK is very good about doing that. So they'll take a look at various samples and see if there was any mutations. In the United States, it's more hit and miss. And so the CDC is currently looking at different samples to see if the UK variant has been circulating. And of course, we found it a couple of times in the country. But to my knowledge, there's not a routine evaluation of the genetic makeup of the SARS-CoV-2 virus, so right now we could have the UK variant circulating within St. Louis, but we haven't done a genetic decoding to see if that is actually circulating. But the point being is that regardless of if it is the current SARS-CoV-2 coronavirus or the UK variant, it doesn't really change the approach. The approach is still going to be wear a mask, social distance, don't gather in crowds, all of those things that we'd be doing otherwise. Where it becomes important is if we know that we have this circulating, what does that do to our potential planning for the number of cases that we're going to see? Because it does have it's reported to have a higher transmission ability than the current virus. And so what does that mean for number of cases? What does that mean for hospitalizations? All of those other things that we need to take into account for planning. But it won't change the approach to the pandemic, all of those things that we've been talking about.
That concludes our list of questions received from members of the media prior to today's briefing. Thanks for watching.